Daily masturbation after 60 can benefit your prostate by reducing cancer risk and clearing stagnant fluids, but only if done correctly. Use proper lubrication, avoid excessive force, and listen to your body's recovery signals. If you experience pain, difficulty urinating, or unusual symptoms, reduce frequency immediately and consult your doctor. A prostate flushing effect. Your body's natural cleaning system. When you ejaculate daily, your prostate undergoes a powerful flushing process that becomes increasingly important after 60. Think of your prostate like a small factory that constantly produces prostatic fluid, one of the key components of semen. Without regular ejaculation, this fluid can become stagnant, thick, and potentially problematic. Daily masturbation forces your prostate to empty completely, preventing the buildup of cellular debris and potentially harmful substances. This flushing effect is particularly crucial for senior men because prostate function naturally slows with age. Your prostate produces less fluid than in younger years, but what it does produce tends to be thicker and more concentrated. Regular ejaculation keeps these secretions moving, preventing the formation of prostatic stones or calcifications that can contribute to chronic prostatitis. The mechanical action of orgasm creates powerful contractions throughout your pelvic floor, essentially giving your prostate a thorough workout that maintains its health and function. The timing of this flushing matters significantly. Your prostate produces the most fluid during periods of arousal and peaks just before ejaculation. Daily ejaculation ensures that this peak production gets completely cleared out rather than accumulating over several days. This regular clearing prevents bacterial overgrowth in stagnant fluids and reduces inflammation that can lead to chronic prostate problems. However, the quality of ejaculation matters more than just frequency. Rushed or forced ejaculations don't provide the same thorough flushing as naturally aroused, complete orgasms. Your prostate needs time to fully contract and empty during climax. This is why daily masturbation must be done mindfully rather than mechanically to provide maximum prostate benefits. Cancer prevention, the 21 ejaculation study and what it really means. The famous Harvard study that found men who ejaculate 21 times per month have lower prostate cancer rates has been both celebrated and misunderstood. Daily masturbation would put you at 30 ejaculations per month, potentially providing even greater protection. But the mechanism behind this protection is more complex than simple frequency numbers suggest. Regular ejaculation appears to prevent the accumulation of potentially carcinogenic substances in prostate tissue. Your prostate concentrates various minerals, particularly zinc, which can become problematic in high concentrations. Daily ejaculation keeps these mineral levels balanced and prevents the cellular changes that can lead to malignant transformation. The antioxidant properties of fresh prostatic fluid also help neutralize free radicals that contribute to cancer development. The immune system benefits from regular prostate activity as well. Daily ejaculation increases blood flow to prostate tissue, bringing fresh immune cells and nutrients while removing waste products. This enhanced circulation helps your body's natural cancer surveillance system identify and eliminate abnormal cells before they can develop into tumors. Your prostate essentially gets a daily immune system patrol that keeps cellular health optimal. Age-related changes make this cancer prevention even more important. After 60, your cellular repair mechanisms become less efficient, making regular clearing of potentially harmful substances crucial. The DNA damage that can lead to prostate cancer accumulates more quickly in older men, but regular ejaculation helps minimize this accumulation through consistent tissue renewal and improved circulation. However, daily masturbation isn't a guarantee against prostate cancer, and other factors like diet, genetics, and overall health play significant roles. The protective effect appears strongest when combined with other healthy lifestyle choices rather than being relied upon as a standalone prevention strategy. Benign prostatic hyperplasia. How daily ejaculation affects prostate enlargement. Benign prostatic hyperplasia, BPH, affects most men over 60, causing the prostate to gradually enlarge and potentially interfere with urination. Daily masturbation creates a complex relationship with BPH that can be both beneficial and problematic depending on how it's practiced. The positive effects center around improved muscle tone and circulation. Daily ejaculation exercises the smooth muscles surrounding your prostate, potentially slowing the progression of enlargement. The increased blood flow brings nutrients that support healthy tissue function and may help prevent the excessive cell growth that characterizes BPH. Regular orgasms also help maintain the flexibility of tissues around the prostate, potentially reducing the compression effects of enlargement. The hormonal effects are equally important. Daily ejaculation helps regulate dihydrotestosterone, DHT levels, the hormone most responsible for prostate enlargement. Regular sexual activity appears to help your body process and eliminate excess DHT more efficiently, potentially slowing BPH progression. The stress reduction from regular orgasms also helps balance cortisol levels, which can contribute to prostate problems when chronically elevated. However, daily masturbation can also aggravate BPH symptoms if done incorrectly. Excessive force or prolonged sessions can cause inflammation and swelling that temporarily worsens urinary symptoms. Men with advanced BPH might find that daily ejaculation initially increases urinary frequency or urgency as the prostate responds to regular stimulation. The key is finding the right balance. Many men with BPH find that gentle, relatively quick sessions work better than prolonged or aggressive masturbation. The goal is to maintain prostate activity without causing inflammation or excessive stimulation that could worsen symptoms. Prostatitis prevention and management. The double-edged sword. Chronic prostatitis affects up to 15% of men over 60, causing persistent pelvic pain, urinary problems, and sexual dysfunction. Daily masturbation's relationship with prostatitis is complicated, potentially both preventing and aggravating this condition, depending on your individual situation and technique. For prevention, regular ejaculation helps prevent the bacterial overgrowth that can lead to chronic prostatitis. Stagnant prostatic fluid provides an ideal breeding ground for bacteria, while daily flushing keeps the environment hostile to bacterial colonization. The improved circulation from regular sexual activity also helps your immune system patrol prostate tissues more effectively, identifying and eliminating potential infections before they become established. The mechanical benefits are significant as well. Daily orgasms help prevent the formation of prostatic stones and calcifications that can harbor bacteria and contribute to chronic inflammation. The muscular contractions during ejaculation help break up any developing deposits and keep ducts clear and functional. However, men with existing prostatitis might find daily masturbation initially worsens their symptoms. Inflamed prostate tissue can become more irritated with frequent stimulation, leading to increased pain and urinary symptoms. The key is distinguishing between temporary aggravation that leads to long-term improvement and ongoing irritation that suggests daily frequency is too much for your current condition. If you have chronic prostatitis, start with every other day rather than daily masturbation. Pay careful attention to how your symptoms respond. Some men find that gentle daily ejaculation eventually reduces their chronic pain and improves urinary function, while others need less frequent stimulation to avoid aggravation. Urinary function, the surprising connection to daily ejaculation. Your urinary and sexual systems share many of the same muscles, nerves, and blood vessels, making daily masturbation's effects on urination more significant than many men realize. The pelvic floor muscles that control urination get a thorough workout during every orgasm, potentially improving their strength and coordination over time. Daily ejaculation can improve urinary flow by maintaining muscle tone in the bladder, neck, and urethra. The rhythmic contractions during orgasm exercise these muscles in ways that normal urination doesn't, potentially preventing the weakness that contributes to poor urinary flow in older men. This muscular conditioning effect can be particularly beneficial for men experiencing early signs of urinary difficulty. The neurological benefits are equally important. Daily orgasms help maintain the nerve pathways between your brain, spinal cord, and pelvic organs. These pathways can deteriorate with age, leading to problems with both sexual function and urinary control. Regular stimulation keeps these neural connections active and responsive. However, some men experience temporary urinary changes when starting daily masturbation. You might notice increased urinary frequency for the first few weeks as your prostate adjusts to regular stimulation. This usually resolves as your body adapts, but it can be concerning initially. The key is distinguishing between temporary adjustment effects and signs of actual problems that require medical attention. Hormonal balance, testosterone, DHT, and daily ejaculation. Daily masturbation creates complex hormonal changes that can significantly impact prostate health. Your testosterone levels naturally fluctuate in response to sexual activity, with levels typically rising before masturbation and falling afterward. Daily ejaculation tends to create a more stable, moderate testosterone level, rather than the dramatic peaks and valleys associated with infrequent sexual activity. This hormonal stability can benefit prostate health by preventing the extreme DHT spikes that contribute to enlargement and potentially cancer development. However, some men worry that daily ejaculation might lower testosterone levels too much. Research suggests that while individual sessions might cause temporary decreases, regular sexual activity actually supports healthy long-term testosterone production. The prolactin response to orgasm also affects prostate health. This hormone increases after ejaculation and helps regulate prostate function, but excessive prolactin from too frequent ejaculation might cause problems in some men. Daily masturbation generally doesn't cause problematic prolactin elevation, but men with existing hormonal imbalances might be more sensitive to these effects. Warning signs when daily masturbation becomes problematic. While daily masturbation can benefit prostate health, certain warning signs indicate you need to reduce frequency or seek medical attention. Persistent pain during or after ejaculation suggests inflammation or injury that daily stimulation might be worsening. This pain might feel like a deep ache in your pelvis, burning during urination, or sharp pains during orgasm. Changes in urinary patterns can also signal problems. If daily masturbation coincides with increased urinary frequency, burning during urination, or difficulty starting your stream, you might be causing irritation that requires rest and possibly medical treatment. Blood in semen or urine is always concerning and requires immediate medical evaluation, regardless of your masturbation habits. Decreased quality of erections or orgasms might indicate that daily frequency is too much for your individual physiology. Your body needs adequate recovery time between sessions, and pushing beyond your natural capacity can lead to temporary dysfunction that might become permanent if ignored. Optimizing daily masturbation for prostate health. If you choose to masturbate daily for prostate health, technique matters enormously. Use adequate lubrication to prevent irritation and inflammation that could worsen prostate problems. Take time to become fully aroused rather than rushing to ejaculation, as complete arousal ensures thorough prostate emptying. Pay attention to your body's recovery signals. Some days you might need longer to become aroused or achieve orgasm, which is normal. Forcing sessions when your body isn't responsive can cause more harm than good. Consider every other day frequency during times of stress, illness, or when experiencing any prostate-related symptoms. The bottom line is that daily masturbation can significantly benefit prostate health when done correctly and with attention to your body's individual responses. The key is balancing the proven benefits of regular ejaculation with your body's need for recovery and your individual risk factors for prostate problems.